Good evening. I'm Dr. Robert Peppercorn, and this is the Medical Explorer. As a specialist in skin cancer, cosmetic laser surgery, liposculpture, and allergies, and as host of this program, I will take you on an exploration of the medical communities of our Northern California counties and bring you behind the scenes of medical care practices right here in our local areas. Tonight, the Medical Explorer will take you behind the scenes of one of our area's newest and most modern medical office buildings. This evening, we will take a tour of a large, state-of-the-art medical structure next to the beautiful fountain on Plumas Street in Yuba City. This new, beautiful building was developed by a small group of doctors who decided to get together and add a wonderful addition to the healthcare facilities that serve the citizens of the Yuba Sutter area. Tonight, we will meet some of these doctors and take a behind-the-scenes tour of their offices, which they call the Civic Center Medical Plaza. And take it from me, it's a very impressive look. In the pharmacy corner this evening, our award-winning neighborhood pharmacist Bob Church will discuss the often confusing concern that women have about hormone replacement therapy. There seem to be never-ending new studies telling women that they should either take hormones or not at the time of menopause. We hear that there are beneficial effects, then we hear that there may be dangerous effects. Tonight, our expert pharmacist Bob Church will try to clear up some of this confusion about hormone replacement therapy in our pharmacy corner. This evening's program will be extremely timely and informative, and I hope that you'll stay with us for the next half hour. Although I usually reserve this portion of our show for medical news, I made a decision tonight to get right into the pharmacy corner so that we can devote the main portion of our program to the impressive new Civic Center Medical Plaza building in downtown Yuba City. It's now time for us to visit our pharmacy corner as we learn the latest up-to-date information on the world of drugs and medications from one of our area's most respected neighborhood pharmacists. Returning tonight in the pharmacy corner, as he has for the past 20 years, believe it or not, is our award-winning registered pharmacist Bob Church from the Medicine Shop Pharmacy in Marysville. Bob, welcome back to the Medical Explorer.
Thank you. It's always nice to be here.
Thank you. It's a pleasure. I enjoy working with you. Can you give us a history of hormone replacement therapy?
Yes, I can. It's actually been an issue that's been in the forefront for a long time, and primarily because there's so many women who, probably 13 million women in this country who take or are interested in hormone replacement therapy. It actually started back in the mid-60s when we started using estrogens or estrogen in combination with progestin to alleviate some of the symptoms of menopause, undesirable symptoms. And then as the years went on, and in recent years, we started using these drugs for protection against certain chronic diseases such as cardiovascular disease and osteoporosis. And as you know, it's been a very controversial subject. There have been many, many studies, excuse me, some of them which support the use of the medications, and others which have been saying don't use the medication. So there's a lot of keen interest on women's part, and there should be. But been many, many studies done so far.
What's this one that I heard about called the Women's Health Initiative Study?
That was a study which actually is probably the best and largest study that's ever been accomplished, and it's still ongoing. It started about 6.5 years ago. Roughly 17,000 healthy postmenopausal women took part in it, and it actually had two arms, one which was just estrogen alone, and then estrogen in combination with progestin. Those were the two main, and then obviously you had your placebo group, and it was very, very well controlled. So that is the latest study that's out there, and part of that's still ongoing.
Why is it so significant?
Well, it's significant from what it showed. The arm that had the combined progestin estrogen use, they stopped that after 5.5 years because it showed a significant increase in risk, about 24%, for cardiovascular disease.
Really?
And for breast cancer.
Wow.
Which really equates down, if you're looking at maybe like a population of 10,000 women, that would be an extra 8 cases of cardiovascular disease, and roughly the same for breast cancer. So that arm of the study was stopped, and they're now recommending that you do not use that combined product.
Would that be like an estrogen and progesterone thing, or
yeah, it would be like the one that the women would know most would be Prempro.
Oh, okay, sure, yes, okay.
And the estrogen by itself, that part of the study did not show those types of results, so that part of the study is still ongoing.
Interesting. Gosh. Now, does that mean that Prempro is not being used now much, or?
It's not being used much at all now. Our sales in the pharmacy of Prempro have gone way, way down.
Wow.
Way down.
So these studies really have an effect on usage.
Oh, they have a tremendous effect.
Gosh. You know, how do women decide what to do? You know, when they take estrogen, their skin feels better, the other skin tissues on their body feel better, they feel younger, they feel more energetic.
Right. They don't have the hot flashes.
Right, the hot flashes is the key thing, sure.
Yeah.
And then the talk of osteoporosis and less bone loss and things like that. What do you do?
It's a hard decision, and we get calls all the time. When this study came out, which I think was June or July of 2002, when they stopped that part of the study, we were just answering questions day after day after day. The thing is, women are concerned, and rightfully so, and I think there's a couple of things they can do. They can educate themselves. It's very easy to go onto the websites, go onto Google and just punch in this study, and there's a wealth of information. So they can educate themselves. They need to sit down and talk with their physicians, because everybody's situation is different. Their needs, their wants are different. They need to decide with their physician and based upon what their own feelings are whether they're going to do this or not. Because there isn't any clear answer that anybody can give a woman whether she should or should not do this. I can tell you that if the use is for the symptoms of menopause, to relieve the symptoms of menopause, you're probably safe in doing it up to about 4 years.
How many years?
4 years.
4?
4 years.
Oh, well, that's not a long time.
It's not a long time.
Well, can I put you on the spot and say, what would you advise a family member or friend to do if they wanted to take the drug?
I would think it's probably safe up to about that point. That's
4
what
years.
the data that I'm seeing supports that. But as you know, these things change.
Yeah.
You know, what's the next big study going to show? You know, it's just sort of, it's for so many years it's been back and forth that I think what you have to do is just sort of educate yourself on the issue and then make your decision, because nobody can really do that for you.
Gosh. Well, you know, we see that people, as they age, their bone structure shrinks, and they're trying to prevent the osteoporosis. We've talked about other drugs,
That's right.
like Fosamax, that might help that, but it's always been with the estrogen, too, I think.
Right. And now they're not promoting the use of estrogen for strengthening the bones. They're actually promoting the use of these other drugs like Actonel and Fosamax.
Oh, okay. So that's not the main
and
thing.
Antivista to do that now.
Wow. Well, interesting. What are some options if women want to not use hormone replacement therapy? Are there other treatments they can choose?
Very few. There are some. There's a drug called clonidine, which we use primarily for controlling high blood pressure, but it does help control hot flashes.
Oh.
There are some of the antidepressant drugs like Prozac or Prozac Weekly that we're seeing used to handle some of the emotional issues that are involved with menopause.
Does that Prozac Weekly really seem to have that long
Yes,
duration?
I have some women who are doing that, and they say that it has given them a significant amount of relief. They feel a lot better.
And just once a week medication.
Yeah.
That's
and
nice.
some of them are only using it like a couple of weeks out of the month.
Ah, interesting too. Yeah.
So, and then there's the drugs for the osteoporosis, which we've alluded to already. So there are drugs out there. Some of the soy products are being toted for relief of symptoms, and I know some women that are doing that. So there are some options, but there aren't a lot of good solid options.
But these things is what women would do if they just decided to stop the estrogen too, or
Right.
are there other precautions they would have to take?
Well, I think the way you stop is important. You need to really taper off of these drugs. And you can do it actually in a couple of different ways. You can reduce the dose, or you can reduce the frequency of the dose, or you can combine both of those methods, but you do need to taper it off over maybe 2-3 months.
Interesting. I want to compliment you on the manner in which you talk to patients and take the time to explain things. I've watched you in your pharmacy literally stop what you're doing while the phone is ringing and people are waiting. I shouldn't, not upsetting anybody, but and take 5 minutes to discuss, almost like giving a little mini educational lecture to the patient. And I think that's wonderful that you take the time to do that.
Thank you, and I think it's an important part of what I do, obviously.
And even when I've been on the phone with you with some things about outside of my field, you've taken the time on the phone with me to give me some information. I kind of like that. It's
Thank
nice.
you.
Very
Appreciate
nice.
it.
As usual, Bob, that was very useful and important information, and I hope our viewers will discuss their concerns about hormone replacement therapy with their pharmacists and personal physicians when they get the next opportunity. We certainly, Bob, look forward to you returning to the Pharmacy Corner on future programs. Now, on with the Medical Explorer. Over the past 22-plus years in the Yuba Center community, I've personally watched the growth and expansion of medical buildings and services around here. We're fortunate to have new centers now sprouting up on a regular basis, buildings such as the Cancer Center, Rideout Hospital's Heart Surgery Center, the new Alzheimer's facility. Sutter North has many project buildings that they've put up and planned for more. They have their Urgent Care Center. My neighbor right next door, Sutter Buttes Imaging, just doubled the size of their building over there with new equipment. So let's leave our Medical Explorer studio here at my Advanced Dermatology and Laser Center and travel about a mile down Pluma Street as we visit a medical building that was a joint effort of surgeon Dr. Fahey, Feather River Cardiology, as well as internal medicine specialists Dr. Kang and Dr. Brar and others. Let's visit the Civic Center Medical Plaza. Having watched the progress of new medical development in central Yuba City, I've been amazed by a beautiful building that was put together through several doctors but coordinated by Dr. Michael Fahey. And I have the pleasure now of introducing you to Dr. Michael Fahey, general surgeon, thoracic surgeon, vascular surgeon, and whatever type of surgeon there is.
Hi, Bob. How are you doing?
It's good seeing you.
Good seeing you, too.
Thanks for having us over to your office.
Well, thanks for coming down here. It's been a pretty exciting year for us over the last year to 18 months while this building went up.
I've been watching your work in the community for more than 10 years, and you know, everybody knows you now as one of the leading surgeons of the community. You've been that way for a long time here. But it's really nice now you have your own, office like this that's beautiful, have it really classy done. Tell me a little bit about how this nice, tremendously beautiful complex came to be.
About 5 years ago, we were in rental property over in Yuba City, and our waiting room was always crowded. In the current era, we need about 6 or 7 phone lines, and we need an office that's wired for computers. And none of the 1960s and 1970s version medical offices fit that criteria. So we thought we'd get together and remodel one of the existing Yuba City buildings, and that project just started to snowball. We picked up Dr. Jasbir Kang, Dr. Guman, and Dr. Yash Brar, and together with our wives, we started to look at which property would fit our site. It turned out that we needed about 10,000 square feet, and we were about ready to purchase a property and move on it, and Feather River Cardiovascular Institute decided that they needed new offices. They're ready to expand and add partners and expand their horizons with the advent of heart surgery coming to Yuba City. And we just got together by luck, mainly because we're all friends and we work together in the hospital system. And we came to the Yuba City Redevelopment Agency, which was quite helpful, and we looked at the plots of land that were available here at Town Center and picked out this one right across from the fountain. On a nice day, we get to have the fountain and the fountain noise in the background.
Is it difficult to put together a project with so many doctors who all have their own independent ideas about what they like to do? Is that a project?
You know, Bob, I think I see my office manager's head bouncing in the background saying, yes, it was. The idiom that's used for that is that it's like herding cats. When you try and put 10 doctors into the same space, it's like herding 10 cats and asking them all to agree on the same thing, none of which is possible. But we managed to get to this point, and we're just ecstatic.